You may have heard that retained primitive reflexes cause issues with speech, feeding, attention, sleep, anxiety, immunity, learning, coordination, and the list goes on and on and on. But what's the real deal? Well, we don't have any empirical data showing that those claims are true. So let's talk about it. Primitive reflexes are involuntary responses that originate in the brainstem and are protective responses present at birth to support survival. These are things like the Moro reflex, the sucking reflex, or the tonic neck reflex. They integrate at varying ages in early childhood, but typically between 2 and 12 months old. However, these reflexes are sometimes retained with certain neurological conditions like cerebral palsy, seizure disorders, or traumatic brain injuries. It's also possible for these reflexes to have never been present for the same reasons. So let's stop there. Yes, retained primitive reflexes is possible, but they are often a symptom of something, not the cause. Remember, correlation does not equal causation. Claiming retained primitive reflexes are the cause for something like transitioning to solids is like saying that eating more ice cream increases your risk of sunburn. Correlated, sure, but not causal. With primitive reflexes, the underlying neurological diagnosis is typically the causal factor, not the other way around. Okay, now that we've got that down, what about the interventions for these retained primitive reflexes? Using things like massage, e-stim, stroking, passive movements, and non-specific treatments are not likely to support improved functional outcomes. A large portion of the research and protocols on these methods come from the Muscatova neurosensory motor reflex integration studies and Robert Melillo and Jerry Leisman's work. MNRI has been shown to be lacking in scientific evidence to support treatment outcomes. Actually, the Wisconsin Department of Health even considered it just one level above harmful experimental treatments in its review. Robert Melillo and Jerry Leisman both gained financially through brain balance, which has consistently been scrutinized by scientific communities and multiple organizations because it lacks evidence to show the program, which includes primitive reflex integration, is actually beneficial to children. Additionally, the program makes wild claims like they can cure autism. When we look at background, Robert Melillo received his master's degree from the Carrick Institute of Graduate Studies, which is a chiropractic academy in Florida that isn't accredited by any agencies that are recognized by the Department of Education. His second master's degree is also from a now defunct program at Toro College. Both Melillo and Leisman have had multiple retracted studies and continue to have the integrity of their research questioned by scientific communities. Both of these organizations' website and market are overwhelmingly full of testimonial, too good to be true claims with no research to support. Oh, and just about anyone with any type of diagnosis can benefit from those services. Additionally, what is published is super low quality, primarily consisting of opinion pieces and highly biased methods. Now, I get that sometimes we don't have research to support every single thing we do, but we at least want to see some plausibility based on theoretical principles to guide our decision making. And we want the research that we are looking at to be as high quality as possible, not good marketing disguised as research. And yes, clinical experience is important, but we can't just fill in the gaps with whatever we want. But what about the clinicians and families who claim that this is working? My first question is if they're also using task-specific interventions. If so, that's most likely the reason for change, and the integration therapy just looks cool. Think of it like ensomes. When people use things like chewy tubes and passive stretches and exercises alongside functional activities, they see changes occurring and often attribute those changes and progress to the combination of both. However, comparative studies and research in neuroplasticity and motor learning principles consistently tell us that we don't need to waste our time on things like ensomes, and we need to focus our energy on functional task-specific exercises. Our patient and family's time, energy, money is better spent on the interventions that are actually likely to make change. Child having difficulty with articulation, work on articulation. Child having difficulty with chewing, work on chewing with food. Even when people are touting words like quantum or synergistic, it doesn't make it more scientific. So anyway, keep asking questions, request references, read more than just the abstract, pause to think critically, and be aware of the signs of pseudoscience. Okay, bye!